kind of post-operative medication most of the time.
So when you're having this procedure done in your office, I know you use a little bit, you use some painkiller there where
on the surface of the skin, yeah.
Where you're putting that thing in and going through and doing what it is that you do to the vein. Does that hurt?
Well, it feels like a pinch just when, your doctor...
That's all you feel?
You feel a pinch when you're, like when your doctor's putting in Novocaine to remove a cyst or a spot on the skin. That's what you feel. And then you're going to feel some pushing and pulling just from the ultrasound probe and things like that.
That's what the ultrasound probe, I guess, is what I was talking about.
Yeah.
So that's just pinching and pulling. It's not really uncomfortable or...
Yeah. We actually stock laughing gas or nitrous oxide in my office like the dentists use. For people who are really anxious, I have never had to use it.
Okay,
never.
That's good. That's good. So really, the pain that people were experiencing before was from the laser?
The post-operative pain was from the old kind of laser.
Yeah.
Meaning the pain afterwards, not during the procedure itself.
Not during,
yeah.
Okay.
It was just that they were more sore than they are now. What they're experiencing now is virtually nothing.
Right, and I'm sure it's, for some people, so painful that having a little bit of pain to get it taken care of, to have no pain after is certainly worth it.
Yeah, for most people it is.
So it can be very painful, I guess.
Varicose veins?
Yes. Really?
In terms of pain, it's more of an ache. It's more of a throb. It's more of a sensation of fullness and heaviness in the leg. It's not going to be that kind of horrible burning pain if you throw your back out or you twist your ankle, that kind of thing.
But I can see, it certainly looks like if you have varicose veins, it can certainly interfere with your life. You may not want to go... maybe you walk or you jog or you ride bike or skiing even, things like that. I can see where it certainly could interfere in your lifestyle.
And that's one of the criteria the insurance companies use when they're determining will they pay for someone's varicose veins, especially if they don't have any of those inflammatory changes we talked about on the skin. How does this interfere with their life? Well, if you have to sit down a lot at work, if you're having nighttime leg cramps and it's preventing you from getting a full night's sleep, if you have restless leg syndrome and it's preventing you from getting a good night's sleep, if you have an ulceration on the leg, which is painful and weeping and interfering with work, that's definitely interfering with your life.
That looks to me, when you're talking about some of those sores and all that, it looks to me like it would need to be wrapped in gauze or something and constantly changed.
That's exactly right.
Is that how people are living?
Yeah, we do something called an Uniboot to try to heal those up. Interestingly, in the past with leg ulcers, we used to think that you had to heal the ulcer first before you would treat the underlying veins. We now know that by treating the underlying veins, you can actually heal up that ulcer.
And we saw a picture of that, right?
Exactly.
The gentleman's ankle that was all swollen and 3 times the size of just a few weeks after you had treated him. Hey, there it is.
There you go.
That is a huge difference. Now, what was the time frame from the first photo to the other photo? It doesn't even look like the same.
Yeah, it's approximately 3 months.
3 months, okay.
Yeah. And he had it for about 3 years prior to that.
He was living with that for 3 years.
Yeah.
Oh my goodness. That looks just awful. I don't see how he could have done that.
Well, it is what it is.
You tough guy. Absolutely. All right, we're spending some time with Dr. Dohner from Oneonta Laser. Derm the number 607-433-8815. We're going to take a break. We'll be right back to wrap up right here on News 15.
You're watching your hometown station, WISF.